Well, it is unique and it's hard to find. A relatively new therapy treats a list of ailments. So what makes one-on-one physical therapy different? Well, Dr. Seth Peterson, founder of The Motive, is here to tell us all about it. Such a pleasure to have you here.
Awesome. Nice to be here, Alex.
To see you. So when we talk about physical therapy, I think people might have something in mind and it may not be exactly what it is. It turns out it's a lot of different things, right? So tell us what that is specifically in The Motive's view.
Yeah, great. So that was a great question. I think a lot of people, especially my patients, ask me that. Once they end up in a physical therapy clinic, I think they're surprised in what we do. So the general term now is we're movement experts. So if you think about where our education is, the majority of it is in exercise. So we have more exercise-based education than anyone else. We actually have twice the amount of pain education as doctors do in medical school.
Excellent. So you're well prepared for pretty much anything somebody has to throw at you. So what conditions would you say that you see most often in your office?
Right, so our clinic is an orthopedic clinic. So kind of an example of an orthopedic condition might be back pain. That's over half of our patients. Neck pain is the second most common, and then we kind of split it up between shoulder pain, hip pain, knee pain, stiffness, weakness, anything like that is common in our clinic.
You know what's funny is you start listing off all these things and my body I start feeling it everywhere. And we're going to do a little demo here in a minute and it's going to sort of help relieve some of that. You said back pain, a little bit of hip pain maybe. But let's talk specifically about one-on-one therapy and what that is and what makes it different than other types that people may have been used to.
Right, I think the norm now across the country is when you go to a physical therapy clinic, you spend half the time or 3/4 of the time with an aide or an assistant.
Okay.
So especially when it comes to aides, those are people that haven't been educated formally in physical therapy. And if you think about it, yeah, they're spending the majority of the time with you.
Right.
So there is actual research that shows that leads to a worse outcome. So when we opened The Motive, we just wanted to completely flip the script, and so 100% of the time at The Motive is with a physical therapist. We have no aides, we have no assistants, so we believe that you get better outcomes, and so far the outcomes tracking that we have puts us in the top 1% in the country.
Oh, that's encouraging to hear. And of course, you don't need unnecessary appointments. If you're targeting the problems immediately and you have a specialist that knows what they're doing the first time around, then chances are you're not going to have another appointment. So should I get on this table now? You're going to walk me through one of your therapies?
Yeah, yeah. So we talked
down
a little bit about some hip stiffness you were having ahead of time.
I did. I did a little cleaning yesterday. And I was scrubbing the heck out of the bathtub, and I think that got my back and my hips.
So scoot to the right a little bit. I'm going to use my good body mechanics here.
Okay.
And
walk us through what you're doing here.
So really the first thing, we kind of ahead of time took a brief look at your hip.
Yeah.
So now when we have you on the table, we're just trying to take another look at your hip to make sure that what we saw was indeed what it looked like.
Yeah.
And so typically we'd compare it to the opposite side to get a sense of what your normal is, and then come over here and look at this and say, how's this compared to normal? And it does look maybe a little restricted into flexion there, right?
Got it.
So there are numerous different types of treatment. Being that we have a table here and the setup that we do, one thing that we would do is just take a look at the mobility. And now I get a chance to feel this hip.
Yeah. It's a nice comfortable table too. And so how's that hip compare, I guess you can't really tell yet, to the other one?
Yeah. So first, all right, now we have the normative data on the left side. Now we get to take a feel of this hip.
And what are you trying to accomplish with this that you're doing now?
So what we're doing now, this is just a little oscillation of the joint. Okay. So we're taking, if anyone's seen a hip joint, if you've seen a hip joint, it's a ball and socket joint. So we're finding where is that the most free to move, and you're moving the ball away from the socket.
Oh yeah, already feels better. You know, I was telling you before the show that I did hurdling in high school in track and field, and that really, I think, really messed me up for the long term. Because you know, if you fail and you land, a little sideways, it's going to sort of get your hip. So this could be something I've been dealing with for many years, right? You get patients, I'm sure, that have dealt with things for decades, maybe.
Right, and I think a lot of these conditions, you and I are relatively young, but a lot of our patients are, over 55, and it's funny, the conditions that you have, or the injuries that you have when you're younger and play sports, they do end up catching up with you later on usually.
Well, I'm like 80 on the inside, so I'm on the outside, but definitely
You're an old soul.
So we're talking about this therapy. Give us just a brief overview of the other things you do. Ooh, that feels nice.
Right. So, and I think this is a good example. Since I'm here,
Yeah.
in the interest of time, I'll give it a little tug. And then we might reassess the movement there, since that
Okay.
was a few minutes.
Yeah, there it is. Oh, I already feel the difference.
Okay, well, that's a little freer.
Oh, man. And I can go run a marathon maybe that leg.
Right. Engaging the muscles, right? We talked about exercise being
Yeah.
something that's the physical therapist forte. Been this, well, keep that straight actually,
Okay.
just so the camera can see this.
All right.
So we might have you push your knee down at an angle here, Alan.
Okay. And we are running out of time, so I want to make sure we get to the end of this. Is it sort of, this leg's done, right? Then you'll have to do this one?
Well, if you only have stiffness on the right,
Then
we
you
might
only have
just
to do one.
this.
There you go. So you don't do things that are unnecessary. That's
Right.
what we're seeing.
And then we teach you to replicate it
Thank
at
you.
home.
I feel better already. Thanks for being here. All right, guys. Right now, the Motive is offering a free discovery visit for anyone that mentions the Morning Blend. All you have to do is call them at 520-389-5311. If you want more info, visit themotiveaz.com.